I'm Colin Hung, editor at Healthcare IT Today, and I'm looking forward to this conversation about one of my favorite topics, patient experience. I'm joined by Tony Thomas, CEO of Windstream, a Fortune 500 company that is working to connect and help healthcare organizations connect, communicate, and collaborate more effectively. I'm also joined by Ray Han, also with Windstream Enterprises. And finally, we're joined by Dave Ashish, CIO of GoHealth Urgent Care, which operates multiple facilities in many states, including Georgia, New York, and Oklahoma. Thank you, gentlemen, for joining me.
No, it's our pleasure to be here.
Tony, we'll start with you. Windstream Enterprises and Windstream work with many different industry sectors, and you solve business challenges across multiples of them, including finance and retail. And those industries have really adopted the consumer-centric approach. Are we ready for that in healthcare?
I think we are ready for that, Colin. When you think at the level of competition, what really drove the transformation in retail explicitly was competition. When you look at the competition that GoHealth sees in urgent care, it's going to drive this tremendous focus on the patient experience. And when you see clinics popping up at Walgreens, CVS, it feels like every national hospital chain has an urgent care facility. You have disruption coming from telemedicine. How do you differentiate? Ultimately, it's through a great patient experience. And so the time is now for healthcare to embrace the patient experience and take the lessons that we've learned in areas like retail and financial services that were probably a little bit ahead of healthcare in terms of that transformation.
And how has Windstream Enterprises helped pioneering organizations like GoHealth become more consumer and patient-centric?
One, we work with great partners. It's clearly a collaboration, but we take the experiences that we have had in these transformations and recognize there are some critical elements to having a great patient experience. You have to have a great network. So one of the things we often forget about is you have to have the infrastructure to enable the services that are so critical to the healthcare transformation from a patient experience perspective. So we really step back and say, what can we do with our customers to ensure they're going to provide a great patient experience from end to end, including some pieces based off our own experience we know customers have overlooked in the past, to make sure we share our insights and those troubles that other folks have found through transformations like this.
All right. Now, Rayhan, you just did a presentation with Dave, and it was on or around the topic of taking some of these lessons learned from other industries and adapting them to healthcare. Can you maybe share a couple of those with us?
Sure. So, if you think about very specifically the digital journey of the patient itself, right? It's from the patient acquisition, the patient care, to the patient retention. In all three of those phases, lots to be learned. How do we continue to improve that experience? Think all the ways from a patient being able to, before they even come in, go online, wherever they are, look up the most convenient, closest location, be able to schedule that online, and know the wait time before they even walk in. And they've already signed in. That digital sign-in has already happened. So when you walk in, you get in that urgent care center. If you think about the past, in the past it was that old office with that window and old magazines sitting around, and Dev talked about this in his presentation very clearly. But now in that new concept, it's this open reception area. There's tea, there's coffee there. Consumers come in with that continued experience, that Wi-Fi that they've been on, whatever they're doing, surfing on the web or social media, that's a continued ongoing experience even inside. And all the ways when they walk into a patient room as well, it's that continued experience for them, right? It's all about that continued experience.
So during your presentation, you had one quote that stuck out for me when you basically said, in healthcare, we have little room for error when it comes to the patient experience. Can you maybe expand on that a little bit for us?
Sure. So, I think Tony touched on this a little bit as well. Some of the learnings we've had in the retail space, and what we've seen there is, the baby boomers are a little less forgiving than the millennials. They may give you one or two tries before they give up. So when you have that patient, you have to make sure that experience is good for them, so they keep coming in again and again for you, right? So that's one, and it's a parallel to what's happening in the retail space. And as you further expand on it, you think about it, how do you get that patient to come in again and again, constantly, right? So there's many ideas around that digital journey, the things that we can do, and Dev will talk about that and has talked about it in his presentation as well. I'll let him cover that.
Excellent.
Yeah.
Dave, you've done some incredible things over at GoHealth, from everything from your welcome areas. Notice I didn't say waiting room.
Thank you. Thank you.
And through the online interactions that you have with patients, you guys have really thought things through and thought things out. Why have you invested so much in the patient experience?
Yeah, I think the patient experience is really first and foremost, right? Like our vision, our mission, right? Like we talk about unparalleled experiences. Experiences being like in multiples, right? Like every single time when the patient comes back and all of those things, right? The company itself, Colin, we were founded really on the premise of getting the patient to the right side of care, because when we look at it, there's so much that happens inside an ER that's so expensive for the patient and for our healthcare ecosystem, and we wanted to get that to the right side of care. So we really started out, okay, let's build these urgent cares to offer a patient-friendly experience and unparalleled experience for the patients. So you're absolutely right? Like it is the lobby. We call it the lobby at GoHealth Urgent Care, and the reception areas, it's all open, right? All of those things. So we definitely have invested the time and the effort to think through the patient experience. How can we simplify it? How can we make it effortless for the patients? How can we have it just work for the patient, the family members, and all of the rest of the community as well, right? So it is absolutely super intentional, and I'll just say, right, it is thought through, and part of it is we keep listening, right? It's not just here's the best we can do, but you have to keep improving on what you did yesterday.
And what's the reaction been from patients?
Oh, it's been phenomenal, right? I love the reaction from patients. I think it's so interesting. Patients. One of the things, Colin, we do is, right, like, of course, when the patient comes in, and I spoke about this in the presentation as well, we do the Net Promoter Score, right? So patients will get a text, hey, on a scale of 1 to 10, how likely are you to recommend us? But then they do that. But some of the other surprising reactions also, right, is patients will come back into the centers and bring us some cookies. Home-baked cookies, like, hey,
Wow.
you guys were such phenomenal caregivers to me or to my family day before yesterday or whatever, right? So the patient reaction has been wonderful, right? Patients, I don't want to say patients ever enjoy coming to a healthcare facility, right? But I think in some ways when you talk about the patient experience, we started from there, right? Healthcare has always been, in some ways, a captive audience. People go to large hospitals because they have no option but to go there. But Tony talked about it, right? Like, especially in the urgent care and the retail field of healthcare, chances are in a market like New York, our patients are walking past our competitor or they're walking past us to a competitor, right? So how do we offer that differentiated product? So I think we've received really good, we spoke about the NPS, phenomenal scores, something we are really proud of, something we really watch for as well.
Excellent. Sounds amazing. It sounds like an amazing patient experience. But let's talk a little bit about staff. How has the staff reacted to all this attention that you've been putting on patients and the consumer experience?
Yeah, I think it's the cultural piece, right? I think the staff is absolutely bought into it, and I think people come into healthcare for many different reasons, right? Healthcare is a very personal choice in so many different ways. So I think we've had great, and it helps, right, when the patients walk in with cookies. Right? It helps, but one of the things I'll share, right, like, it's not just the cookies. We have patients that have written us letters. We have patients, and sometimes we talk about patients coming to urgent care because they want to avoid the ER, right? And we very closely watch our ED transfer rates and all of those things, but we do send patients, we do refer patients to the ER, and lo and behold, 3 or 4 days later, they'll come back and thank us for sending them to the ER with our medical judgment after stabilization and all of those things, because we were able to get them there, right? So I think the staff is super excited about delivering that world-class care. And some of it I'll share too, right, is the staff is excited. They write in the stories to us every single day.
Wow.
So we have 125 centers. Every single day, every center sends us a message about how their day went. And they'll write in, right, like, hey, this patient complimented us or this family member complimented us. So the staff is all bought in, and I get to personally, I share some of those stories with our IT team. And it's just phenomenal, right? I think it just builds up the whole concept of taking care of the patient.
Amazing. So if I was one of your peers at another organization and wanted to do kind of what you have done at GoHealth, what would you recommend to me in terms of where to start?
Maybe talk to us.
Step one, talk to you and bring some cookies, apparently.
Yes.
And letters.
No, I think I'd say focus on the patient, right?
Okay.
I think healthcare for the longest time has gone inside out, where the focus has been on the care delivery team, and less on the patient and the family members of the patients. And we've really done it more from the outside in. What do the patients want? What do the family members want? So we don't even think like when we wrote our vision mission statements, right, we didn't even put the word patient in there. We said consumer in there. And we said consumer or customer because we wanted to be about the patient and the family member, right? If the kid is being brought into the urgent care, the customer is the kid, the mom, the dad, and maybe even the sibling, right? It's not just the kid that you're trying to care for. So I'd say focus on the patient, listen to what the patients are telling you, and not just what the patients are telling you directly, but also listen to what your frontline staff is telling you. Because the frontline staff every single day, right, 125 centers, they are the ones dealing with patients who are satisfied or not satisfied, or patients who are agitated or whatever, right? Like, if we can listen to our frontline staff and improve our patient experience, I think that's the way. That would be my suggestion.
Final question just for you. Why was it important to find a partner like Windstream Enterprises to work with in this sort of consumer-centric journey that you've been on?
Yeah, to me, technology, I think Tony talked a little bit about it, right? Like, technology allows you to focus. If I know that my infrastructure is dependable, if my providers know that the systems are going to work, they can focus on the patient, right? So to me, it's about being able to focus. I'll give you a small example here. When we were setting up our very first center, our chief customer officer at the time, like, he said to me, Dave, whatever you do, don't put a slow printer here at the front desk. And I turned around and I'm like, why would you say that to me? He says, because if you put a slow printer, the front desk person is going to want to make small talk with the consumer and say, oh, I don't know why this thing is not working. And then the whole experience that we would have delivered clinically would just go down, right? So it's about dependability and focus. And if the technology works, then the care team can focus on the patient and the family members.
Excellent. So let's expand on that. Tony, why don't you give a comment to me around that? Why is it so important to the patient experience to have good infrastructure?
And building on really what Dev was talking about, ultimately, you don't want your practitioners worrying about when they hit the enter key, whether there's going to be latency, whether they're going to have to make that small talk, and it's something that's going to disrupt the momentum that they have in a conversation. And honestly, when you're trying to innovate in a competitive market through differentiation, you're going to have continuous innovation, and you need to make sure you don't necessarily know what's going to come left or what's going to come right, but you're going to get feedback. You're going to have to continue to change. And when you look at the urgent care market, think about the impact of high deductible healthcare plans on the consumer, and now they're now really the patient experience, because it's really their money. They don't see it as an insurance company, they see it as their money. And having a network infrastructure where it's reliable, you can count on it being up, it's also flexible enough to scale with you as you grow, is really going to be the table stakes of how you are able to differentiate in these other critical parts of the patient experience.
Ryan, what about you? What's your thoughts around the impact that infrastructure can or should have on that patient experience?
Sure. Infrastructure is something so basic that mostly people think of it as a necessary evil, and it's more of the assumption is it's gonna work, but it is the core element that supports all the applications. So you think about this space specifically in dev space, right? Whether it's guest Wi-Fi or online scheduling or being able to bill or frictionless, you're a patient, you walk out without even checking out, right? All that is enabled by some application that's riding on some infrastructure, and it's dependent on that infrastructure always performing. And then there's an element of security, right? Security infrastructure hand in hand goes side by side. And even when you start thinking about, especially in this space, as there's acquisitions and there's partnerships going on, there's aggressive growth, right? Infrastructure has to perform every step of the way.
Interesting. Since you brought it up, we'll start with you, but
Sure.
You brought up security. Obviously, it's very critical.
Yeah.
How critical is cybersecurity to that overall patient experience?
Sure. So I won't touch on the liability element. That's an obvious, right? I think we all know that. But brand reputation.
Good point.
One time, patient information leaks, your brand's done. Very hard to clean up. You look at some of the larger banks and some of the ads commercials are running asking for forgiveness. You're in that situation then for a while, right? And from a technology perspective, you get like a ransomware type attack, technology stops. That's it. You're stopped at that point, right? So it's impacting heavily.
Dave, what about you? Comment around just the impact that cybersecurity can have on.
Yeah, I mean, I'm going to use really what Rehan talked about. He used the words brand reputation. I'm going to use the words trust. Patients come to us trusting us, right? Trusting our clinical judgment. They are at the time of need, right? They're not feeling good. And so to me, it's all about trust. And any sort of cybersecurity breach is frankly, a loss of trust, and it's not something that anybody can afford, right? You just don't want to be in that position, and unfortunately, healthcare has been a targeted sector recently, so we have a good team that keeps us
Keeps you safe.
right? Yeah.
Love it. Tony?
I think these gentlemen covered it. I mean, really, when you think about it, it's disruptive to your existing customers, it's disruptive to your prospects, trust in the brand. It all comes together. I mean, security has to be part and parcel now of any good infrastructure plan.
Excellent. Final question for each one of you. What's the one thing that you would like our viewers to take away from our discussion today? What's that one thought that you hope they take away?
I would tell you, when you look at that one thought, and of course, sometimes I can't get it down to one thought, but when you think about Windstream Enterprise, we want to be there to provide that reliable infrastructure experience, whether that's a network, unified communications, but really we want to do that with our partners so they can focus on how they win in the marketplace, which is by having an exemplary patient experience. And that's what I want your viewers to take away, that, hey, we want to be that partner, that trusted advisor that can take you on that journey through the technology so you can focus on what's most important to you, which is how you win every day in a very competitive marketplace.
Excellent. Dave, what's your one thought?
I'll probably go back to the first question that you asked Tony here today, right? Is the healthcare scene ready for such a patient experience? Absolutely is, right? If anything, I want the viewers to take away is patient experience absolutely matters, and let's get that right from all aspects, right? Like we are at HIMSS, right? Interoperability is a big part of the patient experience. Why does the patient have to be re-imaged, right? A bunch of those things. So let's focus on the patient experience and deliver a phenomenal patient experience.
Thank you. So I would say Windstream has been very customer-centric and extremely focused in the retail space. And there's a lot of common parallels to the healthcare retail space in retail. A lot of learnings that we bring to the table and would like viewers to take advantage of that.
Excellent. Well, gentlemen, it was such a great talking with you. I learned a ton. Thank you so much for your time. I really appreciate it.
It's good to see you, Colin.
Thank you.
This has been Colin Hung from Healthcare IT Today, just talking with these fine gentlemen about patient experience here. Thanks for watching.